Hello, all our viewers. Welcome back to my YouTube channel. My name is Terry, and my channel name is Terry the Arena Kids. I'm here to talk about health matters, matters that are affecting your day-to-day activities. So I wanna talk about the basic things that we need to do to prevent infections. So you know that some diseases are airborne, some are contact, you can have bacterial infections. So today I want to talk about what you can do to prevent infections that are caused by contact. So there are contact precautions that you need to do to ensure that you do not get infections. So I'll talk about a disease like cholera. For you to start having cholera or dysentery, or for kids to have maybe like any diarrhea diseases, it's mostly contact. You touch something and then you put it in your mouth, you ingest it. So like if you don't clean your hands very well, like if you visited the washroom and you do not clean your hands very well, you're going to ingest a lot of organisms that might cause diarrhea. So the most important thing to do is to have to do good hand hygiene in your houses, in your offices, in your places of work. Before you ingest anything, ensure you wash your hands thoroughly. And when I say washing your hands, it doesn't mean touching water inside a basin and then you say you've washed your hands, because that's what most of us do. You take one basin, put in some water, and then pass it across for people to wash their hands. That is wrong. When you do proper hand hygiene, you must have some running water and soap. And then you have to ensure that you rub your hands in between your fingers, in the palms, behind your fingers. You ensure that you touch as you rub your hands for 20 seconds. 20 seconds is enough contact time to ensure that you've actually washed your hands. So in the next video, I will be showing you steps of hand washing so that you ensure that we take this knowledge to our families, to the place of work, so that people do proper hand hygiene to prevent diarrhea diseases. So the other thing is ensure that you do not ingest dirty water to prevent diarrhea diseases. You have to take water that is treated. If you cannot treat your water, maybe you can you can boil your water, then put it in a clean container, let it cool. That is safe for you. And then when you're boiling, it has to boil. Yeah, so just ensure that you take clean water and your hands are clean. When you're coming to cook maybe your vegetables, ensure that you clean them well before you start preparing your meal. Also ensure that when you buy fruits, you wash your fruits with soap and water. Yeah, so that you ensure that you're ingesting food that is free from germs. So I just wanted to pass this information across because that is so basic for all of us. We need to actually ensure that we clean our hands, teach your children to wash their hands, and if you do that, you will avoid frequent visits to the hospital. And if you visit the hospital frequently, it costs money, and this can be avoided by doing proper hand washing. So if you have house managers, take them for a course. We have people who train house managers on basic first aids that they can do to the kids at home, just in case they're in the home and there's a kid who has a problem. They're able to identify that this needs attention. So, and then if you teach them hand hygiene, you will ensure that you're eating food that has been prepared in an environment that is clean. So let's try our best. And then if you have a hand sanitizer, you can carry it with you. If you can afford to get one, put it in your kids' bag so that they can sanitize when there's no water and they need to clean their hands. So information is power. So we need to pass this message across. I know teachers are really doing a good job in schools. They're teaching their children to do hand hygiene, and also the schools can provide soap in the washing. When you have hand washing areas in the school where we have taps, let's make it a habit to ensure that we have soap in that area, so that our kids can learn the good behaviors, and they should know that they cannot eat without washing their hands. And this will help to ensure that your kids do not visit the hospital frequently. So we talked about how to prevent diarrhea diseases, the basic hygiene and precautions that we need to take. So next time we will talk about something else. We want to talk about conditions like tuberculosis, because most of it's now we get so many cases of TB, and we need to know that we need to know the signs to watch for. We need to know how TB presents, so that we are able to help our families in good time. So I will just talk about the signs and symptoms of TB, and then that topic we will continue next time. So if you have a cough that is more than 2 weeks, you've been treated your cough, your doctor told you it's a viral infection, and after 2 weeks you're still coughing, you notice that you have lost weight that you cannot explain, and then you also notice that you have night sweats, you sweat a lot, especially at night. You can wake up and your beddings are wet. Yeah, you need to be worried about that. So just ensure that if you're coughing more than 2 weeks, you lose weight and you have night sweats, and then you present with fever on and off, fever chills, and you feel like you're getting weak, just see a doctor. There are many tests that can be done to ensure that we get a diagnosis and treat early. We will talk about TB in our next video. For now, I will say bye bye, and to encourage you people to continue watching my videos. Watch my videos, subscribe, like and share. This is knowledge that doesn't need to be lying somewhere. People need to hear about this, so that we have a healthy nation, so that our kids are healthy, and that we spend less in hospitals. Thank you.